Hello friends, in this segment we will explore about jaundice and its symptoms, and in the last of this vlog we will check how to get rid of these symptoms and control this if someone is suffering from. So jaundice, which is a state of health in which the skin and whites of the eyes become yellow due to increased bilirubin in the blood. So bilirubin is a yellow pigment that the body produces when it breaks down old red blood cells. Normally, the liver processes bilirubin, mixing it with bile and then getting rid of it through your digestive system. However, under normal circumstances, the liver may be incapable of releasing bilirubin, or there may be a problem at any place that removes bilirubin. When a high amount of bilirubin gets into your body and accumulates, you may become jaundiced. This is not a disease. So, this is not a disease on its own, but rather a sign of underlying health issue. There are several reasons why someone might get jaundiced. This may be due to liver sickness, such as hepatitis or cirrhosis, in which the effective breakdown or processing of the bilirubin in the liver may not be properly realized. It may also occur when there is some obstructions of the bile ducts, for example, passage of the bile from the liver to the intestine. This could be from gallstones, or in very severe cases from cancer passing upon or blocking these ducts, such as pancreatic cancer. Jaundice in adults often indicates a significant health issue that needs a medical evaluation. In addition to yellowing of the skin and the eyes, it can be associated with other signs such as dark urine, pale colored stools, and itching. These indicate to the doctor what is causing jaundice, for it is impossible to treat it without treating the problem that causes it. The awareness of jaundice and its meaning should hence be very key. This then would be the clear indication from the body of something that would have definitely gone wrong, more so with the liver or bile system. Well, until now we have known that what caused the jaundice and the pale of the eyes and the skin. So, what is bilirubin? The question followed by a viscous brownish yellow substance that is a natural product of liver processes like break down old red blood cells. That is also explained that the yellowish substance, which is a bilirubin. And in next we will see how the jaundice as icterus, or the yellowish, less frequently greenish pigmentation. So bilirubin is also could be a yellowish and the greenish pigmentation, but greenish pigmentation is less frequently. Mostly we see in the symptoms yellowish bilirubin of the skin or the sclera due to high bilirubin levels. Well, the classic definition of jaundice is serum bilirubin level greater than 2.5 to 3 milligram per deciliter, that is 42.8 to 51.3 micro per liter. So in conjunction with the clinical picture of yellow skin and sclera, so this reading 2.5 to 3 milligram per deciliter or 42.8 to 51.3 micro per liter should be in conjunction with the clinical picture of yellow skin and sclera. Well, the bilirubin metabolism takes place in 3 phases. Number 1 is preheptic, 2 is intraheptic, and the third one is postheptic. So here one question arises: what is the 2.5 bilirubin mean? Normal bilirubin levels are generally less than 1 milligram per deciliter. Adults with jaundice generally have bilirubin levels greater than 2.5 milligram per deciliter. In otherwise healthy newborn, bilirubin levels between 0.2 and 1.3 milligram per deciliter are considered normal. So I repeat again, adults with jaundice generally have bilirubin levels greater than 2.5 milligram per deciliter. In otherwise healthy newborn, bilirubin levels between 0.2 and 1.3 milligram per deciliter are considered normal. On average, total bilirubin levels between 0.2 and 1.3 milligram per deciliter are considered normal for children and adults. If your levels are higher, your healthcare provider may want to investigate further to look for the cause. It may suggest a problem that needs attention. In next point, in order to lower bilirubin levels, you should drink lots of water. So obviously avoid alcohol and keep away from the red meat. In case of symptoms, what one should eat lots of fruit and vegetables and increase your fiber intake. For the fiber intake, obviously when you eat fruit, but there is a law and there is a research evidence. The fruit should be eaten empty stomach, especially in the morning. Well, if you eat fruit, which is normally people do, after the meal, it will just accumulate sugar in the body. If you eat empty stomach, it will give you vitamins, fiber, and energy to consume for the whole of your day. So in the next point, high bilirubin levels often indicate poor liver health, and in addition to getting checked out by a doctor or your healthcare physician, especially the integrative medicine or natural medicine, but if you want to change naturally these indications to help lower your bilirubin level and improve your liver function. Well, thanks for watching. All the best.